when it happens in children, some of those side effects might imitate other disorders. For example, there's a lot of kids out there that have ADHD, and they may not have ADHD, they may have an untreated sleep diagnosis. So when they come into my office and they're like, oh, they're concerned about ADHD, and I'm examining them, and you know, they have like the dark circle under their eyes, and in kids, it's more of obstruction, like with their tonsils, and they open their mouth, like, oh, their tonsils are huge. And I'll ask the parents, like, do they snore? Oh, all the time.
Yeah.
Have you ever noticed any like gasping or anything? Yeah. So then I do the investigation, get a sleep study, and then see that, wow, no, they actually had a sleep disorder.
Wow.
So like, I just love that overlap. And as I said before, just being a neurologist makes me a better sleep doctor and vice versa.
And I'm just thinking, like, how many people have been diagnosed wrong? You know what I mean? Like kids, when you're talking about ADHD and sleep disorders, you know?
Right, and trust me, I think about that. And with that being said, there are still kids that have obstructive sleep apnea and ADHD.
Yeah.
And there's some where I'll do that investigation and they didn't have that. It's just like that question that you ask about it. And one thing with me being a sleep doctor, the hardest part about my job, I have to talk to you about things that happen when you're unconscious.
Yeah, that's true.
You know, I talk to patients and I'm like, well, do you snore?